Welcome to Consumer Update. I'm Kelly Lightbourne. Thanks again for joining us today. From treating conditions such as diabetes and hypertension to hormone deficiencies, the staff at Peaks of Health Metabolic Medical Center in Largo is dedicated to finding whatever it is that stands between you and your health. Here to tell us more is Dr. Tracy Lenhart, the Medical Director of Peaks of Health Metabolic Center. Welcome to the show again.
Well, thank you. It's good to be back.
Love having you here. You know, we've talked about a range of topics through the year, but today we're actually going to talk about something we've never spoken about before, which is thyroid issues.
Yeah, thyroid ends up being so important, and so many people aren't aware that they're having thyroid issues.
Mhm.
You know, and I kind of explain to my patients, thyroid is the speed of every cell in your body. So it's just not weight, it's just not, your metabolism, but it's how fast your brain works. It's how fast your heart works. It's how fast your liver detoxes, how fast your intestinal system works. So it's that important to the system. And so when it's low, people really have a lot of symptoms they may not be aware of.
No, and that's interesting because I always thought it had to do with your weight, and it doesn't.
Yeah, I mean, it does, but it's just one little aspect of it.
Right.
Obviously, if your metabolism slows down, you're going to gain weight.
Right.
But, it's also your thought process may slow down. Your thinking may slow down.
Really?
Your heart rate slows down. How well your body functions, how your skin. That's why so many symptoms, hair loss, loss of eyebrows, fatigue, dry skin. There's so many different symptoms associated with thyroid disease that just people don't realize.
So clearly this is an important topic.
It is a
Clearly.
very important topic.
What are some signs that people would look for to even know that they're having an issue with their thyroid?
Well, the main sign that most people think of is they're tired and fatigued.
Okay.
Then they do start gaining weight, but they can be very stressed out. It may not be working correctly. Diabetics usually have thyroid issues. So we have so many different aspects, especially if you start losing your hair, if you start having constipation.
Telltale signs.
They're telltale signs of thyroid disease.
Now, I always hear the terms like hypo or hyper. What's the difference? What is that?
Yeah. Well, hypothyroid is when the thyroid slows down, so it's not working as well as it should. Hyperthyroid is when it speeds up. So
Okay.
again, you're going to have different symptoms. You're going to have anxiety, sleeping issues, fast heart rate, palpitations, weight loss. You're going to feel really hyper.
Okay. So, I mean, is the best course of action just to come in? Are there tests, or how do people know besides
Yeah.
these telltale signs?
Well, we test the thyroid, and the problem we have is most doctors test what we call a TSH, thyroid stimulating hormone. And this isn't even the thyroid gland. This is what the brain perceives the thyroid gland is doing. So
Okay.
it's a pretty inaccurate test, but it's usually what we look at. When we test, we actually test the complete thyroid. We actually look
Okay.
at the actual thyroid hormone itself. We look at how it's converting, if it's still working properly. And we also look to see if it can hit its receptor site properly. So there's no different kinds of thyroid disease. There's primary, where it's not working.
Okay.
There's secondary, where it's not converting. And there's tertiary, where it can't bind into its receptor site.
Okay.
So that person can have all kinds of problems with it and not even know it, and it be misdiagnosed.
Well, that's what I was going to ask you. You're saying you test, I wouldn't say the gamut. You test a lot of different areas. Is this an issue where people go in and get like a single test and it doesn't really show?
It does.
I mean,
And this
is
is
that-
where I actually learned a lot about that,
Okay.
because I swore to my doctor for years I had hypothyroidism. I was gaining weight, I was losing hair, I was having a lot of issues. And I was told that my thyroid was normal, until it was so abnormal that I was wearing socks in July in Florida because my feet were so cold. And cold hands and cold feet is a telltale sign. So when I actually had it really tested, I was severely hypothyroid, but my TSH technically was in normal range. And
Okay.
so, there was a disconnect there.
So there wasn't a red flag unless you take
Exactly.
that extra step, and a lot of doctors don't take the extra step.
Exactly. So we go that extra mile, and we actually look completely at the thyroid and see if it's functioning. Also, stress is one that can affect the actual conversion of thyroid. So you may have a
Really?
normal production, but not turning it into an active thyroid called T3. And if you don't convert it properly, you are still hypothyroid at the cell level. So you actually have all the symptoms of hypothyroidism.
Wow. So what are some of the treatments that are out there? We know how to diagnose this. We're looking for telltale signs, but what are some of the treatments? Are they changing? Are they?
It can be all kinds of things. It can be as simple as nutrient deficiencies. It can be something as simple as an iodine deficiency because your body needs iodine to make thyroid.
Okay.
So sometimes it's not always that they go on thyroid medication, and then other times they may need thyroid medication. So we can replace that hormone just like any other hormone we replace, and give them thyroid medication. Now we usually use natural thyroid medication as much as possible. We can even custom make it for them.
Oh,
So again, if a prescription won't work because it's not the right dosing, we can custom make that dosing for that person.
No, and I normally don't interject, but I'm actually now a patient, And what impressed me about you guys is you do customize, because I have several family members that come, and one thing about your practice is you do customize everything. So when, a family member went in, it was not the same thing.
Exactly.
You know?
I mean, everybody's different. Their
Yeah.
genetics are different. Their bodies are different.
Yeah.
What's wrong with them is different. So, what works dosing wise for one patient may not work for that other patient. So, yes, I do use prescriptions as much as possible because there are natural thyroids by prescription.
Right.
But if that dose is not correct for them, then we just make it, the right dose for them. We have a compounding pharmacy that will custom make everything for us.
And how do you know if it's working or not? Like with
We
specific
measure
with
by
thyroid?
symptomatology. We actually ask the patients. This is one of the things I noticed. When I was practicing a lot more traditional medicine, we forgot to ask the patient how they felt.
Yeah.
So we do it by symptoms and we do it by levels. So what level works for you may not be the same level that works for the next person. That person may need to be at a higher level. And you may be more, symptomatic, jittery at a lower level. So it just completely depends on that person.
Yeah, and that's one thing I want to stress, just because now I have a firsthand knowledge, is the staff is very in tune to me. And I've never had that with a doctor. I've always avoided going to clinics and stuff because I'm thinking, it's a rotation. I'm being put, they're going to give me whatever they think. But your staff and you don't do that. You really treat the entire patient, which I've never seen before. So I want to thank you for that and really stress that, because it's something that's very rare to
Thank
see
you.
in
I mean,
clinics
that's what we
anymore.
really strive for. I mean, this is customized medicine. This is
Yeah.
individual medicine. So in order to get people better, you have to customize it to that person.
And take the next step.
And take the next
And you
step.
guys take the next step. You ask the next question. How do they find out about you? Website is a wonderful resource.
Yeah,
What do
they can call us. They can go to our website, www.peaksofhealth.com. Our number is 727-826-0838. People can come in for a courtesy 15-minute consultation so they can know whether we're a good fit. Because, not everybody's for everybody. So,
Right.
this way they can know if we can actually help them. Because if I can't help somebody, I'm going to tell
You're
them
gonna
right
tell
then.
them.
Right then and there. I don't want to waste their time or my time.
Right, and I made that 15-minute consultation, and it was the best decision I ever made. So it's
glad.
worth just going in and at least talking to you and seeing if maybe you look at things a little different, because you did with me and you did with my family. So I personally thank you.
Well, you're
and thanks
welcome.
again
It's
for
been
coming on
great.
the show.
Well, thank you very much.
We'll have more when we return.